Hi, my name is Austin Moore. I'm a physical therapist licensed in Minnesota and in Florida. Originally from Stillwater, Minnesota, and recently moved down to Naples, Florida. I have experience in outpatient orthopedics in a variety of settings, post-surgical, as well as most recently in private practice.
Hi, I'm Ryan Maxwell. I'm from Stillwater, Minnesota. I'm a corrective exercise specialist and certified personal trainer with the National Academy of Sports Medicine. Also received additional training from the American College of Sports Medicine and post-oncology survivorship programming.
So physical activity is an important part of rehabilitation for lung cancer surgery for a variety of reasons. So the number one being really is kind of preparedness. So we want to make sure that our body is as prepared as possible as we're going into surgery, because surgery is really such a physical undertaking by the body. It's essentially a kind of controlled injury to the body, if you will. The body will react in the same way that it will to kind of being unexpectedly injured, which is making resources available for the healing and the recovery process. So what we want to do is make sure that we can increase our physical activity to make sure that our bodies are equipped to kind of handle the recovery process. Because we know that people in general, but those kind of living with lung cancer as well, really don't a lot of times get the right amount of physical activity. So we want to make sure that we're increasing that prior to surgery to make sure that our bodies can kind of handle that undertaking and that physical nature of surgery. Kind of liken it to a car with a gas tank. So you want to make sure that you're filling the gas tank prior to going into surgery, because we know that surgery is going to deplete that gas tank. We really want to make sure that we go in with as much gas as possible to be able to handle what comes after surgery. Ideally, you've got you know your surgery date and kind of have an idea of when that's going to be, so you can start as soon as possible. We know that starting as little as 6 weeks before surgery can be really beneficial, in making sure that the recovery process is as smooth as possible. Aside from that, the other beneficial aspects of physical activity prior to surgery is going to create the familiarity both with the provider as well as the program that you might be doing after surgery. So making sure that you're kind of establishing some baselines with your provider, whoever's going to be kind of handling the post-surgical program, and setting some baselines. So understanding where you were at before surgery and where you'd ideally like to get to in terms of your goals after surgery, as well as getting back to your prior functional level, what you were at before surgery. It helps to know where you were at, and where you want to be and trying to get there.
So some of the benefits of doing a prehabilitation program is ultimately reducing hospital stays, increasing your recovery or having faster recoveries, improving your activities of daily life. So increasing confidence in the things that you're doing on a daily basis. And then ultimately, we just want to be able to get through this process with more efficiency and with a plan in mind. And that really helps with having confidence in the whole process. And ultimately, the plan is what is going to give you that baseline. So establishing this and ahead of time is really helping to prepare for it and not having to react in the moment. And that really helps with confidence and getting through this process in a smooth, efficient way.